See, breast cancer is number one, unfortunately, among all the cancers in terms of frequency. So it's very, very relevant and important. And I thank the management, Dr. Urjitha, for being the reason why we are able to establish such a dedicated breast clinic today. And we have two excellent breast surgeons, Dr. Veda and Dr. Kirti, to run this clinic. Since the media are here, I just want to highlight two things. One, there should be more awareness among the public. People should not think I will not get it, number one. They should be aware of risk factors, and let me tell you, the commonest risk factor that I see is overweight. So this is something, this message has to reach the people. And second, they should also be aware that there is a solution. Early breast cancer, 99% survival after 5 years, which is like near perfect. At the same time, advanced breast cancer, it's about 30%. So there's a world of difference between early detection and late detection, and that's what this clinic is all about. Early detection so that we can save every life. And we can at the same time assure all those women who are coming with false alarms. This is the main message I want to convey to the public through you. I thank our chief guest, Mrs. Kiruthiga, who is honoring this occasion and will serve to highlight this among the public. Thank you.
Beautiful yet need of the hour event, and thanks to my friend Urjitha for inviting me today. I always tell people that the more we talk about cancer, the less we can fear it. I think fear seems to kill more people than the cancer itself. So I think it is important that we have these kind of awareness program, take it across to people. And I think, like everyone says, we need to take care of the women in our lives. I think the men should take it upon themselves to take care of the women in their lives. The fathers, the sons, I think you guys need to, because the women are too busy taking care of the men all the time. So I think it's important that you for a minute stop and ask your daughters or your wives how they're doing. If they have done their screening, take them, force them to go and get their screening done today. I think that will make a world of a difference if actually men can also get involved in this. It's always, breast cancer is always about women and the awareness taken across to women. But I think you guys can take it to the men, like, go to colleges, men's college and even children, and ask them to encourage their mothers to go and do the screening. I think that would be a big success, in my opinion. Actually, when you guys were telling me about this mammogram, at 20, if you believe it or not, I went to a doctor. I had fibroid and adenoma in both my breasts, and I was 20 years old. And somehow, I don't know where I got this like guts and courage. I went to the doctor myself because both my parents are working. From a very young age, we were all encouraged to go take care of ourselves. So I went to the doctor said you have to do a mammogram. I went to a mammogram institute all by myself. They were looking at me like, you came alone, why is it anyone, like no adult with you? I said, I don't know what's the big deal. I didn't know until at that point that how important that mammogram was. And then I took that report and I went to my parents and said, you know what, I did all these tests, you have to go to the doctor now and figure out what to do. So it needn't be fear, it can be something like the doctor said, if 99% can be cured at early detection, I think this is something that everyone has to, talk about this at homes, like, it should become a table conversation about, okay, what, cancer is prevalent now, but cancer can also be treated early, so you need to do it sooner than later. I wish you all the very best. I think it's a wonderful idea to bring everything under one roof, to make the patient feel comfortable, to come forward and say, I have this, and cancer should not be like a taboo. Everyone should talk about it, because today when somebody has cancer, the first thing they try to do is hide the fact, because for some reason they feel embarrassed or they think I don't want people to know, but it's okay for people to know so that there's more support and you can address it. So thanks a lot to two people who are very, very important to our cause. Ms. Kiruthiga, thank you so much for being here. And Mrs. Radhika, thank you so much for being here. There are many startling statistics that exist if one were to just Google or ask ChatGPT or any forum about breast cancer or even about breast health. I am 31 and I have a friend my age with breast cancer, and I also have a friend's mother who is currently suffering from the same illness. At this point, this illness is very age agnostic. We don't see it affecting any group more than the other. It affects half the world, which is women. And yet, in our country, the survival, especially I think Chennai, our survival is so poor because of the fact that simple reasons.
நாங்கள் அடிக்கடி சொல்றது என்னன்னா, ஒரு பெண் தான் ஒரு குடும்பத்தின் முதுகெலும்பு. அவதான் மதர், அவதான் டீச்சர், அவதான் நர்ஸ், எல்லாமே அவதான். ஸோ இட்ஸ் வெரி ப்ரைவேட் என்ஜிஓஸ், எங்களை மாதிரி இருக்கிற என்ஜிஓஸும் பண்ணுறோம். ஸோ இட் இஸ் வெரி இம்பார்ட்டண்ட். இது படித்தவங்க படிக்காதவங்க ரெண்டு பேருமே வித்தியாசமே இல்லை. படிச்சவங்களும் ரொம்ப பயப்படுறாங்க, படிச்சவங்க மேமோகிராம்னா என்னன்னு தெரியாது. ஸோ இது வெரி இம்பார்ட்டன்ட் தட் வி டேக் திஸ் மெசேஜ் டு த பீப்புள் அண்ட் டெல் தெம் தட் இட்ஸ் இம்பார்ட்டன்ட் டு லுக் ஆஃப்டர் யுவர் செல்ஃப். நாங்கள் சொல்றது தோழி டெஸ்டடு, ஆரோக்கியத்தை கொண்டாடு. தேங்க்யூ ஸோ மச் ஃபார் இன்வைட்டிங் மீ அண்ட் இட்ஸ்